Hello, it's Dr. Maria Harriet Stack again, and I'm actually doing this video to say I'm taking an early night tonight, but I know that I do these videos just before I retire because we're 9 hours ahead, or 8 hours. California is 8 hours behind London, so obviously it's just after lunch there. And we're here at 22:53. So you're much earlier, obviously, just after lunch. So whether you're online or not, you probably don't start online until later, when everybody in the United Kingdom is asleep in the middle of the night. So I was just saying to you that I made a promise to all of you that I would wear during the day a pinstripe jacket most of the time, especially now in my media room, if you like. Just to give the professional image, and I would just like to show you the jacket that you've all seen. It's the Balmain dark, I don't know if you can see it, the camera, but it's sort of pinstripe jacket, with the classic buttons, and it goes with these little designer earrings from Oscar de la Renta, which goes with my lipstick. And I have a little bit of makeup on, but not too much. Obviously, I've got the studio lights, which are flattering. I just heard today Maria Harriet complaining about lights in some video or other. I totally agree with her that, if you have a situation where the lighting isn't sympathetic, you can actually be photographed in not as pretty a light as with compassionate lighting. And I'm all for compassionate lighting. But that doesn't mean that we're all this glamorous without them. We all have our faults, and skin textures, and age-related issues, which I'm trying to cut back. I think makeup, good makeup, is a very good idea. And if I don't wear makeup, especially when I'm tired, I do really look in the mirror and think, you better get your makeup back on again, because you just look a little bit tired, and I think that ages you, and premature ages you, and gives people the impression that you might be older than you look. When I have always been told I look much younger than I am. But age is something, that is just a number, obviously. But, in terms of healthy lifestyles, it doesn't really matter what age you are. You have to continue, because the prevention of dementia in the over 50s is extremely important. And lifestyle measures is the best way of doing that, because the drugs used for Alzheimer's and dementia, as we heard in the Chris Christopherson case, where he was wrongly diagnosed and actually had Lyme's disease. He was suffering with horrific side effects from the drugs used in the United States for Alzheimer's disease, until his wife, Lisa, I think, was persistent and managed to get a second opinion, which is very hard to get in any state in America or in any country. In in Europe, you almost have to go to a different country to get a second opinion because of the closed ranks and networks of doctors for fear of threats of legal letters and medical negligence and all the stress that causes. So one is told to go back to one's own doctor and get the broken record of the same thing until you decide, well, you've got to go privately. But even then, in many cases, it's very difficult to get a second opinion. Now, I've been abroad for the last 4 years and seen the different medical systems in Paris. I was particularly impressed by President Emmanuel Macron's system for everybody that lives in Paris, and how if you visit Paris, you're entitled to a doctor's visit in your hotel within the Paris district. I don't know far outside the 16th. I don't know how far it goes, but I thought it was a marvellous system that somebody would visit you within an hour in your home and give, look at your notes, look at your previous records, obviously, and decide if you needed an urgent repeat prescription, if you've left your prescription behind, what to do, but also to liaise with a GP going forward, together with his records and his prescriptions. And the cost was, relatively reasonable. I don't know, I won't want to tell you how much it was, but I was taken back at how reasonable it was, and what a wonderful job Emmanuel Macron has done in what he had, the service he's provided, the health service he's provided, the primary care service he's provided for Parisians and for visitors. I was really, I thought that was a marvellous thing about Paris, because I'd never been told this until I investigated their health system, and was told, that they have a system where doctors visit families in their homes through their national health service. But there is a fee, but it's certainly well worth it, and you can get it back in your insurance. And even if you didn't get any insurance, if you didn't have proper insurance, it would still be worth paying, because health is wealth. Spain doesn't have that system that I experienced in Spain and the Canary Islands, but access to general practitioners and to consultants was so much easier. I mean, I became sort of very interested in neurology, neurosurgical research, and so I met neurosurgeons and other surgeons, and I used to kind of almost walk in, as long as I was very well dressed, obviously, and the best person dressed better than anybody else, including the consultant. I used to walk in and have long chats about different diseases and, maybe what the consultant had seen recently. And he was taking my opinion on board about what might be, behind all of this and what the prognosis could be. In some cases, in most cases, nothing compared to what the damage was done to me. And people had recovered, but there was no, generalised condemnation of the mistreatment, which is a kind word, I guess, of me here in the United Kingdom and subsequently in Ireland. But they were really concentrating on the neurosurgical side.